Good afternoon. I'm Mike Dunn, the Hamilton County Communications Manager for Mayor Jim Coppinger. Today is April 27th, and we have three people speaking for this briefing: Becky Barnes, Dr. Paul Hedricks, and Bonnie Deacons. We'll begin with the Administrator of the Health Department, Becky Barnes.
Thank you and good afternoon. We have a lot of information to share with you today. First, the number of confirmed cases of COVID-19 is 149, and the number of deaths remain at 13. Of the new cases, we didn't add any on Saturday. We added one Sunday and are adding 7 today. Now I want to talk about the results of our testing efforts over the weekend. Saturday and Sunday, the Hamilton County Health Department partnered with the Tennessee National Guard and opened our first weekend community testing site at Riverfront Parkway. Through this partnership, we tested 1,377 people for COVID-19, which is more than double the number that we had expected. To meet this demand, both agencies called additional staff to the site. We opened 2 extra lanes, so we had a total of 5 lanes running, and we had a walk-up lane. The Chattanooga Police Department worked very hard to allow for a smooth transition of traffic. We know transportation is a barrier for many residents to get to a testing site, especially if they don't have a vehicle. So we chose this testing site because of its close proximity to neighborhoods and senior high-rises. We designed a walk-up lane to accommodate people who don't have a vehicle and are excited to share that about 75 people participated in this walk-up lane. We want to thank our community partners who helped us spread the word in nearby neighborhoods and senior living facilities, and among them are Paul Lucart and Jonathan Worth with the Chattanooga Housing Authority, Evelyn Woods with Overlook Apartments, Sandra Deering with the Riverview Towers, Christy Wick with Older Adult Community Response Teams, and Evelina Holmes, a community advocate. And there were others, but we are really grateful to our community partners to help us get the word out. Weekend specimens were sent to our lab at Baylor School. We have results from more than half of the 1,377 tested, and to date, 4 of the positives came from our weekend site, and 2 of them are epi-linked. At least 2 of them are epi-linked. Health Department contact investigators are working, identifying and isolating their contacts. We will have another community testing event at Riverfront Parkway this next weekend, Saturday and Sunday, May 2nd and 3rd. The hours are the same, 8:30 to 12:30, and you do not need to be showing symptoms, and you do not need an appointment, and walk-ups will be available again. But I do want to say this: if you are having symptoms or think you have been exposed, please do come to the testing site. In addition to this testing site, we have our regular weekday testing site open to the public at 7460 Bonnie Sharp Drive, Monday through Friday, 9 to 12. Appointments at this site are booked for this week, but going forward, starting next Monday, May 4th, appointments will not be required. You can call our COVID hotline anytime that we're open for any questions or details, and that number is 209-8383. Now our health officer, Dr. Hendricks, is going to discuss testing and general guidances for businesses, and then Bonnie Deacons will follow with guidelines for restaurants. Thank you.
Thank you, Becky. Today I'd like to talk about testing for the COVID-19 virus. There are basically 2 ways to test for this virus. The first is the so-called PCR or antigen test. Now, this is a type of test that the health department performs at its drive-through sites, and it's still regarded as the gold standard for diagnosing COVID-19 because it tests for the actual viral particles that mean a person is actively infected. This testing involves obtaining a specimen from the back of the nose or throat and sending it to the laboratory to be tested to look for evidence of the virus itself. The most accurate way to do this is to put a swab in the back of the nose on both sides. Now, it's a little uncomfortable, but it's very important and very accurate. The most important thing to know about this test is that it's a point-in-time test. It can tell us what's going on right now, if you have the virus right now, but doesn't mean that you can't catch it days later. So again, it only tells you if you have a current active infection, but this is important because that's when you're most contagious. As Becky mentioned, some 1,377 people were tested this weekend, and if you were one of those tested and you fortunately test negative, you need to realize that you're still at risk of becoming infected again. Now, the other testing method that is used is called a serologic test, but most people know it as the antibody test. This test involves taking a blood specimen, can be drawn from a vein or from a finger stick, and then we look for the presence of antibodies, which are proteins that your body produces to fight off infection. Now, while this test can show if you have had the coronavirus, it's not recommended by the CDC or the World Health Organization for diagnosing active infection. The health department is not doing the antibody test at any of our drive-through sites or at our lab at present because we're still waiting for more scientific information on how reliable these tests are and how best to use the results from them. At present, the health department is only performing the best kind of test, or the one that's most accurate for diagnosing active disease, and that is the nasal swab or PCR test. With this test, we can test the virus, sometimes even before you have symptoms, because we know that some people do have the virus without symptoms or sometimes pre-symptomatic, in other words, a few days before they develop symptoms. Whereas the antibody test can actually take days or weeks to turn positive, long time when you are most contagious. So next I'd like to discuss some general precautions that businesses should take to keep customers and employees safe. And then after that, Bonnie Deakins will give some specific recommendations for restaurants as they begin to reopen. First, people who are in high-risk categories, the older people over 65 and those with chronic health problems, should still continue to shelter in place and avoid being around other people. No one who's sick should report for work. If you work somewhere and you're having symptoms, you really should not go to work. And if you develop symptoms at work, you should go home immediately. No one should work sick. All employees should be checked for fever when they arrive at work, if at all possible. And all employees should be wearing cloth face coverings and gloves at work. All employees should continue to practice increased hygiene practices such as hand washing, respiratory etiquette, and physical distancing when at work. And also, all high-touch, frequently touched surfaces should be cleaned at least every 2 hours and sanitized, because we do know there's some possibility of the virus living on these surfaces for a period of time. We're urging employers to allow people to work at home if at all possible, and when that's not possible, to implement the social distancing guidelines that I mentioned, and also to try to modify work schedules, stagger work schedules to minimize the number of people who are there at one time. It's also important for employers and employees to know that if you've had the COVID-19 virus and have recovered, the following guidelines can help determine when it's safe to return to work. Once your fever has been gone, without using any fever-reducing medicine, of course, and your symptoms have significantly improved for at least 72 hours, and it's been at least 7 days since you had onset of your illness. At that point, if you've been over your symptoms for at least 72 hours and it's been at least 7 days, it's felt that you are safe to return to work. But just like everyone else, you should still continue to cover your face with a facial covering and practice the hygiene and physical distancing guidelines that I discussed before. With these precautions followed, you don't have to have a follow-up test. You don't have to wait for your test to turn negative in order to return to work if the other guidelines are in place, because we know there's still some questions about how long the virus might remain in the nose and sometimes can even be still detected in a testing, but it's still felt that once you have recovered, you're much, much less likely to be contagious at that point. There are many things we don't know about this virus, but at this point, that is the best evidence and guidelines that we have for this. So now in closing, I just want to reiterate the nasal swab that we do is still the best test for diagnosing COVID-19, but it is a point-in-time test, which tells us what is going on with you right at that time. And we do want to emphasize that employers do not and should not require a negative test before people return to work, as long as they abide by the other guidelines I mentioned. Now, I think Bonnie will be up to give you some more details.
Thank you, Dr. Hendricks, and good afternoon. I want to take just a few minutes to go over some restaurant guidelines, and these are for employees of restaurants and for their customers. We want to work together to make sure everybody is safe. So, first of all, I want to make sure that employees in restaurants are wearing face coverings and gloves, and those face coverings can be the cloth coverings. They don't have to necessarily be the surgical mask. Employees should report any symptoms of illness to their supervisor immediately. They should follow daily sanitization protocols. Customers in restaurants have to remember that the restaurants are going to have to limit occupancy to 50% of the seating capacity. Tables should be spaced 6 feet apart. Seating should be limited at tables to 6 people. Social distancing standards should be used in waiting areas. Bar areas should remain closed. No live music. And customers should be screened with basic questions about COVID-19 symptoms when they enter. For restaurant owners and operators, remember to sanitize all front-of-the-house contact surfaces every 2 hours. Use disposable menus or sanitized menus between each use. Use rolled silverware and napkins stored in sealed bins. Sanitize chairs and all tabletop items after each table turn. Do not offer self-service buffets, shared condiments, or beverage station reuse, and provide training for all food handlers. Thank you.
Thank you. Now we have open up for questions.
Jake, if you want to unmute.
Can you hear me now?
Yes.
Okay. So I have a two-part question. So the first question is, when will we see the full results from the testing this weekend? And two, now that you're testing asymptomatic people, and if they test positive, are you going to separate the people who are positive without symptoms and the people who are positive with symptoms when you release that now?
Okay. I think the first part is, when will we have the full complement of results from this weekend? And that will depend somewhat on how many specimens the hospitals send, because those have priority over the drive-through. So hopefully by in the next 24 to 48 hours, we'll be able to work through all of the drive-through, plus accommodate all of our specimens from medical providers also.
Gotcha.
And then as far as if someone tests positive, whether they're symptomatic or not, they're still positive. And so the same type of isolation applies to them. So they will be isolated, followed appropriately as our other cases that were symptomatic.
Okay.
Sarah Grace?
Yes, I was just going to ask, what number of tests from this weekend have already been processed? And when you guys start next Monday allowing similar testing without appointments throughout the week, how many are you able to handle in a day?
We processed more than half of what we did this weekend, but again, just because, every few minutes, some of them, will finish testing. I don't have an exact number, but before we came in here, it was clearly over half of the weekend specimens have been tested. As far as Monday, when we start just open testing at our Bonnie Shire site, we typically have about 150 slots that we can accommodate, and that's roughly what we're expecting. We hope to accommodate as we go. We may have to change some things, but we're hoping that by not having to have appointments, it will allow people to make it or just come clearly when they're having symptoms and not have to roll that a day or two.
Let me make sure that I understood that. So you are capable of handling up to 150 a day?
Yes, at Bonnie Shire.
Thanks.
Jake, do you have another question?
Yeah, this kind of goes back to, restaurants are allowed to open at 50% capacity today, and businesses are opening on Wednesday the same. Coppinger told us on Friday, that, CDC guidelines are 10 people or less per room, but restaurants and businesses at 50% are going to violate that. So could you guys just explain the differences for more people being at restaurants and businesses compared to any other social gathering with 10 or more people?
You wanna?
With the restaurants, as you might have heard when I went over the guidelines, we are not permitting more than 6 people to be seated at one table together. And then those tables have to be 6 feet apart. So even if a restaurant, if it's a large restaurant, if it has 50% seating capacity, they are still going to have to meet those guidelines.
Even if that building has more than, say like a restaurant has like 100 people in it, they're spaced out, but is that still not violating, the guidelines that he's provided us to not spread this?
The governor's guidelines to us do include the 6 people per table, 6 feet apart between tables.
That works for me. Thanks.
Sarah Grace, did you have another question?
Yeah, sorry. I was just going to ask, does this kind of low number relative to the number of tests administered over the weekend, does this reinforce, do you guys feel pretty good about the decision to reopen businesses this week?
Well, certainly anytime we test 700 and something people one day and 600 extra the second day, the fact that we've done over half and we only have 4 positives, we're definitely pleased with that. But from the start, our additional testing has always been to find cases. We want to find every case that we have in our community, do a contact investigation, isolate and quarantine. That's how we control the virus.
And just one more quick follow-up question to that. When Bonnie Shire starts taking all these tests going forward, is the National Guard going to be helping with these supplies, or are these supplies that Hamilton County has now amassed on your own?
The Bonnie Shire site is a Hamilton County testing site completely. We haven't used the National Guard, nor have we used any of their supplies or the state provided supplies for this.
Thanks.
Okay, if there are no, Jake, do you have another question, or is that hand is still up?
Yeah, I've got one more. Go back to what I asked at the beginning about asymptomatic for people versus people who are showing symptoms. Analysis, when you get these positive results, that most of them are showing symptoms or most of them not showing symptoms when they test positive. And if that's the case, if more people are testing positive without symptoms, is that more concerning to open the public back up to 50%?
Well, with our four cases that we have identified at the testing sites, I don't have the particular breakdown of how many were symptomatic or not symptomatic. But clearly, like I said, whether you're symptomatic or not, we are going to, it's a positive, and we will do the appropriate contact tracing, isolation, and quarantine. Was there a second part of that I didn't answer?
The second part was like, yes, you guys are tracing people, like when they test positive, you're tracing their, who they've been in contact with and where they've been. But now that we're opening up restaurants and businesses where people are going to be gathering, is that kind of concerning to think about, where someone that's tested positive, they didn't show symptoms and they were in an area where there were a lot of people?
Well, I think we've always said, since this virus first emerged, that there were people that were asymptomatic that tested positive. So clearly that has been part of the mix ever since, we've been dealing with this COVID-19. So yes, it's a concern, but we, as I said, we want to test as many as we can, and we want to find the asymptomatic folks along with the symptomatic cases. Okay, thank you very much.